SUBOXONE for me has helped me stay sober for 2 years. Honestly, it's a lot of things that have gotten me this far, but one of them is SUBOXONE.
Amber lives in Utah with her 2 children. Amber struggled with substance abuse for a number of years. Then she became dependent on opioids.
I was sat down by my family and given a choice that I either go to treatment or that my kids would be taken away from me. I did try to stop the addiction on my own. It consumed my whole day, my whole existence. But it's very powerful. I couldn't do it by myself. I needed help. SUBOXONE is a medication that helps with withdrawal symptoms, helps with cravings, body aches. With SUBOXONE, I can work it all the way through and say, okay, what are the consequences of you getting high? It's just one piece of the puzzle.
As a narcotic medication, SUBOXONE film can cause physical dependence. SUBOXONE film is available only by prescription. It is illegal to sell or give away your SUBOXONE film.
Treatment is my support groups, my doctor, my medication. I do service work, and I work on me. I look at it that I will always be at risk. So that's why I go to support groups. That's why I take SUBOXONE. That's why I do what I do. And that's what keeps me sober today, is all those things.
People who have taken buprenorphine, especially by injection, and in combination with benzodiazepines or other central nervous system depressants, including alcohol, have suffered serious breathing problems and death, and should always be monitored by a physician. Amber had been in treatment with SUBOXONE tablet. At her doctor's suggestion, she switched to SUBOXONE film.
I was able to switch from tablets to SUBOXONE film with the same dosage. The packaging is very small and very thin. It's very easy just to take the doses I need and put it in my wallet and be discreet and, careful about it. I don't have to bring the whole bottle. The pills would kind of fall apart. The aftertaste of the tablet it just never left my mouth. But with the SUBOXONE film, I don't have that aftertaste. You slip underneath your tongue, it dissolves very quickly, so it's a lot easier.
Always store SUBOXONE film safely out of the sight and reach of children. Accidental ingestion by a child can cause serious breathing problems that could result in death.
I have been 2 years sober. People come to now to ask for help, or they come to me and ask me advice. And I'm also doing what I love to do. I work with the geriatric population, and I have my career back. Well, I can feel joy today. I can feel happiness today. Love is everything. For me to give my children what they deserve, being a mom is probably one of the most amazing things I've ever done. And I'm doing it sober so I can emotionally and physically be there for them. It makes me feel really good about who I am today.
Important safety information. SUBOXONE, buprenorphine, and naloxone sublingual film, CIII, is indicated for maintenance treatment of opioid dependence as part of a complete treatment plan to include counseling and psychosocial support. Treatment should be initiated under the direction of physicians qualified under the Drug Addiction Treatment Act. SUBOXONE, buprenorphine HCl, naloxone HCl dihydrate sublingual tablets, CIII, is indicated for the treatment of opioid dependence. SUBOXONE sublingual film and SUBOXONE sublingual tablets should not be used by patients hypersensitive to buprenorphine or naloxone. SUBOXONE sublingual film and SUBOXONE sublingual tablets can be abused in a manner similar to other opioids, legal or illicit. Clinical monitoring appropriate to the patient's level of stability is essential. Chronic use of buprenorphine can cause physical dependence. A sudden or rapid decrease in dose may result in an opioid withdrawal syndrome that is typically milder than seen with full agonists and may be delayed in onset. SUBOXONE Sublingual Film and SUBOXONE Sublingual Tablets can cause serious life-threatening respiratory depression and death, particularly when taken by the intravenous IV route in combination with benzodiazepines or other central nervous system (CNS) depressants such as sedatives, tranquilizers, or alcohol. It is extremely dangerous to self-administer non-prescribed benzodiazepines or other CNS depressants while taking SUBOXONE Sublingual Film or SUBOXONE Sublingual Tablets. Dose reduction of CNS depressants, SUBOXONE Sublingual Film and SUBOXONE Sublingual Tablets, or both when both are being taken, should be considered. Liver function should be monitored before and during treatment. Death has been reported in non-tolerant, non-dependent individuals, especially in the presence of CNS depressants. Children who take SUBOXONE Sublingual Film or SUBOXONE Sublingual Tablets can have severe, possibly fatal respiratory depression. Emergency medical care is critical. Keep SUBOXONE Sublingual Film and SUBOXONE Sublingual Tablets out of the sight and reach of children. Intravenous misuse or taking SUBOXONE Sublingual Film or SUBOXONE Sublingual Tablets before the effects of full agonist opioids, for example, heroin, hydrocodone, methadone, morphine, oxycodone, have subsided, is highly likely to cause opioid withdrawal symptoms. Neonatal withdrawal has been reported. Use of SUBOXONE Sublingual Film or SUBOXONE Sublingual Tablets in pregnant women or during breastfeeding should only be considered if the potential benefit justifies the potential risk. Caution should be exercised when driving vehicles or operating hazardous machinery, especially during dose adjustment. Adverse events commonly observed during clinical trials and post-marketing experience for SUBOXONE Sublingual Tablets are headache, nausea, vomiting, sweating, constipation, signs and symptoms of withdrawal, insomnia, pain, and swelling of the limbs. Adverse events commonly observed with the sublingual administration of SUBOXONE Sublingual Film are numb mouth, sore tongue, redness of the mouth, headache, nausea, vomiting, sweating, constipation, signs and symptoms of withdrawal, insomnia, pain, swelling of the limbs, disturbance of attention, palpitations, and blurred vision. Cytolytic hepatitis, jaundice, and allergic reactions, including anaphylactic shock, have been reported. This is not a complete list of potential adverse events associated with SUBOXONE Sublingual Film and SUBOXONE Sublingual Tablets. Please see full product information for a complete list. To report an adverse event associated with taking SUBOXONE Sublingual Film or SUBOXONE Sublingual Tablets, please call 1-877-782-6966. You are encouraged to report adverse events of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.